Hi, I'm Linda Fiumara and I'm a cosmetic plastic surgeon. Today we're going to talk about surgical options when it comes to breast augmentation. Number one, where are we going to insert the implants, above or behind the muscle? Well, positioning an implant behind the main chestal muscle, the so-called pectoralis major muscle, offers a number of advantages. Firstly, additional coverage. The muscle itself constitutes an additional thick layer of tissue that will cover and therefore hide the implant. This results in a more natural look, as there will be less visibility and palpability of the edges of the implant through the skin. Secondly, we'll have additional support. The muscle, in fact, is a much stronger structure as opposed to the skin envelope, and therefore acts like an internal bra for the implant, leading to a lower risk for implant sagging and bottoming out. Thirdly, the muscle is less prone to undergo atrophy and thinning as opposed to the glandular breast tissue. When implants are positioned above the muscle, they're constantly pressing against the overlying breast tissue, causing it to become thinner and thinner as time goes by. And as a result, the silicone bag may start showing through the skin envelope with ripples and folds. And this happens less frequently with implants positioned behind the muscle. With regards to disadvantages, I would say that going behind the muscle is overall a more traumatic operation for the body. It's a longer procedure that takes 60 to 90 minutes in surgery, with a longer recovery in the region of 2 to 4 weeks. There's also more discomfort during the first 5 days immediately after surgery, and it requires longer time off sports activities. Animation deformity, that is a subtle and temporary movement of the implants towards the sides whenever the chestal muscles are contracted, is also a possibility. However, it only becomes visible with no clothes on. And what about the option of above the muscle? Well, in this case, the implants are placed on top of the pectoral muscle, just behind the breast tissue. So in between these two layers, muscle and glandular tissue. Advantages include the fact that it is less traumatic for the body. It requires a shorter procedure, 45 to 60 minutes in surgery, and a shorter recovery in the region of 2 weeks. There will be very little discomfort during the recovery itself. Among the disadvantages, you might need to consider that the edges of the implants could become more palpable, more visible through the skin. There's a high risk of seeing ripples through the skin envelope and a higher risk of implants sagging or bottoming out over time. So which is the most suitable option for you then? Well, I would say that thin patients with small amount of body fat, with petite frames, very small breasts, patients with very thin or loose skin envelope are definitely more suitable for going behind the muscle. Patients with larger body frames, a good amount of body fat, with excellent skin tone are also suitable for the option of above the muscle. When in doubt, I would always say choose to go behind the muscle anyway. Thank you for listening. Goodbye.